Get started. Hi, everyone. Thank you so much for being here for the Iowa Hunger Coalition's January 2025 monthly meetup. My name is Luke Elzinga. I'm the Policy and Advocacy Manager at the DMARC Food Pantry Network in Des Moines. I also serve on the board of the Iowa Hunger Coalition. Just a couple quick things about the Hunger Coalition if you're not familiar. We're a membership-based 501c4 organization. We have a volunteer board of directors, no paid staff members, but we do have a contract lobbyist. John and Cindy Peterson are our lobbyists. And we try to bring together individuals and organizations to address food insecurity and build equitable food systems in Iowa through education, advocacy, and policy change. This is our mission and our guiding principles. So if you want to learn a little bit more about these principles, you can visit our website, iowahungercoalition.org. There's more about them on the homepage, and we worked with our membership to craft these statements last year. So feel free to read more about those and reach out if you have any questions. We are going to be hearing from a guest speaker for the majority of the meeting today, but I do have a couple of updates. First, on the federal advocacy side, just a reminder, there was a year-end funding package in Congress, and there were some hiccups with that package. And in the original kind of piece of legislation, there was funding included for replacement benefits for victims of SNAP skimming theft. So for folks who have had their EBT card basically stolen and the benefits used, there was a way to get some of those benefits back. It actually wasn't even full replacement. So I think $200 was the maximum. Those funds were not ultimately included in the final bill that passed. So I guess we can thank Elon Musk for that. So that all of that is to say, right now, if folks are having their benefits stolen through skimming, there is not a way to get those benefits back or any replacement benefits. There was a process before that people would go through to report that to the state and file a claim. If you hear of victims of SNAP skimming, please, I would encourage them to continue to contact the Department of Health and Human Services to report that, just so we're continuing to have an idea of how much this is happening. We would also love to hear from folks too at the Iowa Hunger Coalition. This is something we're going to be working on with federal advocacy to get those reinstated. So the more stories we have from Iowans who have been victims of this that we can share with our elected officials, we want to make sure we're elevating those stories and getting those in front of our representatives. Other update on the federal side, you may have heard talk of in Congress using a reconciliation process to pass a big package or maybe two big bills. We've already heard that there may be calls to restrict access to SNAP or cut benefits in that package. It sounds like at minimum, this could look like freezing future benefit increases, so cuts to future benefits. And this is something that has come up before. There are talks of undoing those permanent benefit increases, which would look like a $70 a month cut to SNAP benefits for Iowans. So this is something we're going to be paying very close attention to. And just also wanted to say, please let us know if you would like to connect more on federal advocacy. I know some of you on this call are very familiar with doing federal advocacy with IHC and other groups. So please let us know if you want to connect. I know this is something we're going to be putting out action alerts and keeping members informed on. All right, switching to the state side. We are in the third day of Iowa's legislative session, the 91st General Assembly. Just a quick update on some of our priorities. So these are our this is our state legislative agenda. And this is not the full scope of it. If you visit our website, you can see more points under each of these, but these are kind of the big ones. So one is summer EBT sunbucks. The second is making improvements to SNAP. A couple of those being raising the income eligibility and investing in double up food bucks. Making the Choose Iowa Food Purchasing Program permanent and expanding funding for that, and investing in healthy school meals for all. So we are only on day 3 of the session, but there's already a couple bills that we're keeping an eye on. And I'm happy to say that they're both positive, good bills. So one of them is Senate Study Bill 1012. It's a $1 million appropriation for the Double Up Food Bucks program. And I think the most exciting thing about this bill is we've had a lot of success in the House before in getting Republican sponsors for this. We haven't had as much success in the Senate. This bill was sponsored by not only someone in the Senate, but the chair of the HHS committee. So we're feeling really good about this bill. And hopefully we'll be hearing about a subcommittee being assigned soon, and we can put out updates to you all to contact folks. At minimum, if you want to reach out to Senator Klemesh, you could do that. I can type his email in the chat here and just drop a thank you for introducing that bill. The other one, and this just dropped this morning, is House File 59. This is $2 million for a grocery reinvestment fund and local produce processing grant. This is something that some of our partners at Center for Rural Affairs and Iowa Food Systems Coalition have been working on. There's some things I really like about this bill. It's basically supporting infrastructure upgrades for grocery stores, but in selecting those, they're prioritizing, well, they have to be small independent grocery stores, but they're prioritizing ones that are located in high need, low access areas and that accept SNAP and WIC. And so just knowing that we've seen some, grocery stores close both in rural and urban areas of the state over the past few years, we want to make sure that we're continuing to provide access to food in communities across the state. So that's not one we've been taking so much the lead on, but we definitely want to support. This had some good movement last year, and so we'll be following that one as well. And that was introduced by Representatives Brian Losey and Chad Ingles. Now, without further ado, I am going to turn things over to our guest speaker. And I need to change the sharing settings, I realize. 1 second. So I want to introduce Brittany Herrington with Food Bank for the Heartland and the Iowa SNAP Hotline. And Brittany, I will just turn it over to you and stop sharing. And then you
Sure,
take it
thank
away.
you. If you haven't had an opportunity, please make sure that you drop your name and agency or where you're joining us from. That'll help with my tracking for sharing the toolkit today so that I know who to send a copy out to at the conclusion of this meeting. So Brittany Herrington, Food Bank for the Heartland. I am the Director of Public Benefits here. I've been in this role about 6 months. In my seat, we manage a hotline, as Lou said, for all of Iowa. We also manage the Nebraska hotline. We help lead some collaborative efforts for the state outreach plan, both in Nebraska and Iowa. So we have a very interesting seat in getting to work with different stakeholders across 2 states and 2 different F&S regions. So really appreciate being invited here today. So I'm going to be sharing like a copy of the toolkit and going through that. But if anybody has any questions at any time, I'm a very informal presenter, so please feel free to stop me and just ask if you have any questions. So let's share. Okay, is everyone able to see that? Do you need me to zoom in at all? Or is it legible? Okay. So This toolkit is for people who are maybe helping neighbors and applying for uh, SNAP. It's more geared towards educating professionals or agency partners and what SNAP is, a very high level overview of some of the questions you might receive if you're trying to encourage folks to apply, what some of the eligibility requirements are, but it's not meant to be a super deep dive into everything SNAP, but really to give that high level overview so that you can feel comfortable trying to answer questions of folks that may benefit from applying for SNAP. Um, I'm sure it's not news to this group of people, but food insecurity remains at historically high levels in Iowa. SNAP is a critical part of trying to make sure that people get the food that they need. Um, like we touched on, this toolkit is to help to guide you and your agency and referring people to SNAP. It's going to talk about the basics of the program, um, the eligibility criteria, how neighbors might be able to interact with their benefits or utilize their benefits. What does it look like if someone actually receives benefits? And we do have a reference at the end of the toolkit that has a list of frequently asked questions. So those are all of the things that we're going to cover today. This map shows the different people responsible for outreach according to region. So I am doing this presentation today because it's a statewide group. And so I do a lot of the toolkit training when it's a statewide individuals. But if after this presentation you're wanting someone to come to your agency and speak to other members of your team, these would be the people that you could contact to ask for a presentation. We're over here in the Western region. Kezia was our outreach contact. If you've had an opportunity of working with her, her last day was the 31st of December. So right now I'm the contact and I'll share that information with everybody as well. So this top section goes into the reasons for SNAP. And it's because it's a very efficient way of helping people to be able to buy food for their family at their local grocery stores. Not only does that give people dignity of choice, but it also allows people to make purchases based off of dietary needs or cultural needs of their families. Instead of distributing food, which can be a more costly way of providing food, SNAP provides 9 meals for every one meal that's distributed. So it's just a very efficient system for trying to address food insecurity. Here is SNAP by numbers in Iowa. These are from fiscal year 2022, Center for Budget and Policy Priorities. They have not released updated numbers, so that's why these numbers are from 2022. But from what we're seeing, they're still holding true, if not, getting worse. So in 2022, just under 300,000 Iowa residents benefited from SNAP, which is about 9% of the total population in Iowa. 66% of SNAP household participants included households that are comprised of at least one child. More than 50% of those enrolled in SNAP are considered working families, and more than 31% of households enrolled included a family member who are older adults or disabled. I think that this section is really great at highlighting who is actually receiving SNAP benefits and dispelling some of those common myths about the people that are accessing this resource. SNAP eligibility, in a nutshell, people have to meet basic income guidelines, are a citizen or a qualified non-citizen, or are children who are born in the United States and can be eligible for benefits even if their parents are not citizens. That's a pretty common question that we get asked. Here are the current income guidelines. So we've included up to 6 members. For each additional person in the household, you would add $719 to this 5,596. And that would be the gross monthly income threshold. Benefit allotment. Approved household will receive benefits on a physical EBT card. They are loaded alphabetically between the 1st and 10th of the month. The day is determined by their last name. The allotment will vary based off of the household size and income. As many of you can imagine, that is also very similar to when we're busy on the hotline. If there are issues with people receiving their benefits on the day that they have come to anticipate, then we see a higher level of people calling us, asking us some questions about where their benefits are or why they might not have received any. So if you are helping people to apply, you might be able to anticipate that you'll receive some questions around the 1st, the 10th of the month, because it's when people have come to expect that their benefits are being allotted. So for enrollment, people can submit online, over the phone, or in person. Following the submission of their application, households will be contacted by Iowa HHS for an interview. State employees are the only workers who are able to complete that interview. So all applicants have to talk to a state employee to complete that interview process. Applicants may be asked to provide additional documentation relating to their income, if they are taking any deductions or reductions for medical expenses and things like that. They may be asked to submit documentation of that. Final determination will be given by Iowa HHS following the interview process, and applicants must complete a recertification process for benefits. The timeline of that depends on some household parameters. And so it could be anywhere from 6 to 12 months that they'll need to recertify for their benefit. The department will be contacting people prior to that recertification period so that people should be aware. Obviously, we know people move and sometimes don't get that letter. And so if their benefits do lapse, they will need to submit a new application to be considered. Let me pause there before we move into the frequently asked questions. Okay, great. Some of the items that can be purchased with SNAP, items can be purchased at any authorized retailer. There's a really great website that you can go to that lists all of the retailers. I know that many of the Hy-Vees in Iowa are also allowing you now to use SNAP benefits for like pickup or delivery if that location does that, and that can help some homebound-based individuals or people with transportation issues. And so I think that sometimes highlighting retailers that are able to overcome some of people's obstacles in receiving food is a good highlight that, if people are embarrassed to maybe go to their local grocery store, that their grocery store might allow them to use EBT benefits in those alternative methods. SNAP can be used to purchase most food items, including bread, cereal, fruits, veggies, meats, protein, dairy. SNAP cannot be used to purchase alcohol, tobacco, non-food items, medicine, or hot foods. So this frequently asked questions page has how to apply. Like I said, phone, online, mail. It gives a little bit more context about some of the documentation that they might need to submit. If you're needing assistance, what's the best way? We list our hotline number. We are open Monday through Friday, 8 to 5. We are able to complete applications in both English and Spanish using internal staff. If someone speaks a language other than English and Spanish, we do have access to a translation line, and we'll be able to help them to complete an application that way. When will I receive my SNAP benefits? This just sort of re-explains what I had talked about above, that benefits are automatically loaded the 1st to the 10th. The day is based off of the alphabetical order of the primary household applicant's last name. We talked about what we can buy with SNAP benefits. Here's a little bit more information about the reapplication process. If an individual is denied benefits but they think that they should qualify, what are their options? This is, they can call us and we can resubmit an application. We won't be able to see why they were denied. I can say that the primary reason people are denied is failure to provide the documentation that the state has requested or failure to appear to the interview. That's not always the case, but just asking folks if they say that they were denied to ask, did you have an interview where you asked to submit any documents, that can help to drive that conversation about maybe what had happened. Depending on the window of when they're asking this question, you may be able to help them to set up an interview with HHS or to submit that documentation. But we can also always help to facilitate that process. If they're wanting to resubmit, you can have them call us and we can help them with that. If they are, if they need to change information related to a household, they have to contact HHS. We're not able to do that. Once the application is submitted, it's submitted and we can't go back in and then rechange any of the information. If they have lost their EBT card, that is actually operated by a third party, and this is the number that they would need to call to ask for a new EBT card. Any questions about the frequently asked questions? Okay. So this page has a household has applied for benefits, now what? And it's a pretty clear step-by-step of here are the options, again, for how people can apply, what they can do if they're waiting for a response, what may be needed for the interview, if they're approved, what they can expect. And then once that recertification period comes up, what they may or may not need to do for that process. This is a little bit more information about the SNAP hotline. It again includes our hours and days of operation, that it's a free of charge service, what the service sort of entails, because I think that sometimes people can be concerned about who they're going to be calling or who they're going to be sharing their information with. We do also include that we have times of high volume. Recently, we've had pretty consistent months of very high volume. So if they don't reach us right away when they're calling, please ask them to leave a voicemail and we will return their call. Direct language assistance is available in Spanish, but we have a language line if they speak other languages. But if they are looking for information related to the status of their application, or changing any information, we aren't able to do that. So they will need to contact HHS. And I mean, that's really the whole toolkit. Does anybody have any questions about anything that I've shared?
I have a question.
Sure.
As an individual, can I also get the link to this toolkit?
Yes, anybody who's on the call and has added their name into the chat, I will email you a copy of the toolkit.
Okay, that answers my question. Thank you.
Yeah, no problem.
I had a question that I should probably know the answer to. Can people recertify online, or is that only over paper?
No, they can recertify online. On the hotline, we aren't able to do a recertification application, but if they've applied online and have that portal access, they are able to do that recertification through the state.
Thanks.
Brittany, question. Hasn't there been some change in eligibility? Is that related to some Iowa legislation in the last year or two? Has that been SNAP? And if so, how do you see that's affected participation?
Sure. Yes, the eligibility changes annually, partly that's just related to the income guidelines, because they look at those and update those every year. I think that it's been sort of hard with some of the legislative choices about eligibility and sunsetting of some COVID era um, eligibility statuses that allowed more people to apply. I mean, we have seen a very high number of people calling. Um, we have also been submitting a lot of applications. And so from my end, there's, sunsetting COVID that is limiting eligibility in certain respects, but we are seeing like the need go up. And so we are seeing applications and calls go up. And I think it's a little misleading about some of the eligibility changes that have come about in the last year. I think that there are people that it's really related to there's a really high need. Um, and so we're seeing similar call volume as at the start of COVID.
Thank you.
Mm-hmm.
Yeah, and I was just for everyone else's knowledge, one of those like flexibilities was for able-bodied adults without dependents and the kind of time limit that resumed, and also when Congress had a debt ceiling deal in 2022, they kind of extended the age that those requirements applied to while also doing some other exceptions. But yeah, I think you're right, Brittany. It's hard to attribute any one thing because we know just, I mean, at food banks and pantries too, the need is just so incredibly high right now. So
Katie, I saw your question. Last month, we did about 13,000 calls. I mean, I really can't uh sort of overstate yeah, how big the need is from the number of calls. Obviously the hotline operations was prior to my time here at the food bank, but that's sort of what we use as a comparative for the work that our staff is doing. And I know in October we had a similar call volume and similar number of applications as during COVID, and that hasn't been true for the last 2 to 3 years. So it's just, yeah, it's been very high.
that's another question I had was, are there any kind of similar themes you hear from callers about whether that's the reason they are applying, or just, things that they have difficulty in completing the application that your helpers are really able to kind of walk them through?
Yeah, um, some recent trends is we have been hearing a lot more about um, need. I think that we always sort of hear about need because naturally through our service, like that's sort of what we hear about. But I think just from conversations that I've had with my direct staff, that there is a level of pressure on families right now that, is really making people concerned in trying to access resources um, that seems like it's novel just because of, my staff's experience and tenure on the hotline. Um, that that's something that they're hearing a lot about. The COVID extensions ended. I want to say that most of them ended in July or August. It was soon after I had started. I could be wrong though, and can double check that. Luke, I don't know if you happen to know when the COVID extensions ended off the top of your head.
I I would have to look. I know the benefit the maximum benefits ended in April of 2022, but I think some of those other flexibilities through FNS were a bit longer. Yeah,
Mm-hmm.
I don't remember off the top of my head, sorry.
Well, I'll send out the toolkit. Something that I'm going to be, we update the toolkit in the, I don't know, late summer, early fall every year. So something that I'm going to be doing this year is putting together a little bit of a survey and just sort of asking, are you receiving questions that we don't have on the toolkit? Is there information that would have been helpful to be included? Just so that we can also try to stay current with what our partners are experiencing and hearing on the ground and trying to assist people in accessing SNAP.
Well, thank you so much, Brittany, for joining us and sharing more about the hotline and the toolkit. I hope this was helpful to everyone on the call, just as a resource. Hopefully we don't, well, I mean, we want to send people your way, but I know you're also very busy already. So just get the word out there, let folks know. I know sometimes it can seem kind of daunting to fill that application out. So just letting people know that there's a phone number that they can call and people will walk them through the process, I think can be really helpful. So thank you so much. We'll be sure to share out that resource. And yeah, follow up with the regional coordinators as well that are in the toolkit to stay engaged. So thank you again. I'm going to quick share some final updates just on ways to stay engaged. Tomorrow, Thursday, we have an IHC outreach and membership committee at 11 a.m. if you want to get involved with that. John Bowler, I see, is on the call. He chairs that committee, so reach out to John if you would like to join. On Friday, we are hosting a regional gathering in Mason City, co-hosted with Healthy Harvest of North Iowa. And that will be from 9 a.m. to 10:30 at Community Kitchen in Mason City. You do not need to pre-register in advance, although we would love if you did, just so we kind of have know who's going to be there. You can find more information on that on our Facebook page, or reach out at our Iowa Hunger Coalition at gmail.com, and we'd be happy to share information as well. Next Thursday is the Iowa Food and Farm Day on the Hill, hosted by the Iowa Food System Coalition. We will be there. Two of the big priorities for IFSC are Double Up Food Bucks and the Choose Iowa program. So we'll be there talking with legislators. Would love if you could join us there. And then on Tuesday, January 28th, the policy committee will be meeting at 1. Feel free to reach out to me if you'd like to learn more about that. Staying connected with us, the absolute best way is signing up for our email newsletter. So if you're not already signed up, if you just go to our website, iowahungercoalition.org, you should get a pop-up to sign up for our email newsletter. Also encourage you to share with others. Like us on Facebook. If you would like a lot of updates and emails from me, especially during the session, we can add you to the Iowa SNAP Advocates Google group. That is, that's basically a listserv for sharing updates. And then join our monthly meetups. Third Wednesdays, obviously you're here this month, but these happen every third Wednesday of the month at 10 a.m. So thank you all for being here. I know we ended a bit early today. If there's any questions, feel free to stay on or post them in the chat. I did see a question from Jan about Governor Reynolds' condition of the state, providing support to address the issue of transportation between childcare and preschool. Did this and/or other policies she is championing look hopeful? My condition of the state notes are currently being scribbled on, but they are right here next to me. I think that was a positive thing we heard. Also, she mentioned raising wages for childcare workers. So that was good to hear. Um, there were some comments about raising Medicaid reimbursement rates. But yes, Medicaid work requirements did come up during that speech, which is something we had heard from some legislators, hearing the governor talk about it as well, not encouraging. So that's something we're going to be following. I have not heard anything about SNAP work requirements though, and tying those into. Um, I will just mention SNAP work requirements already exist for a lot of people, especially able-bodied adults without dependents. But there is more that the state could do. Mandatory employment and training program is something that they've proposed before, but we haven't heard anything about it yet. So hopefully, we don't see that, but obviously we know that if folks lose access to Medicaid, that has a ripple effect and that can contribute to food insecurity as well. So that is something we're going to be keeping an eye on. The governor also mentioned creating a state Department of Government Efficiency Doge, and named a business leader to head that. It sounded like they were talking about local government pieces, so that just kind of raised my eyebrows a bit. But I do think there were some other positive things mentioned. So yeah, anything anyone else wanted to share their own takeaways? It could have been worse, I will say that. All right. Well, thank you all for being here. I have a toddler to entertain. So we'll see you all next month. Please reach out if you have any questions.